In previous lecture, we have discussed the coronary circulation, which is responsible for this ischemic heart disease. In this lecture, we will introduce ischemic heart disease. Uh, I will try to cover ischemic heart disease mainly its introduction, its epidemiology, and why ischemic heart disease caused in left ventricle as compared to right ventricle. So we will try to discuss these three things. What is ischemic heart disease? First of all, we have discussed the coronary vascularity. Coronary vascular system, which was composed by the right coronary artery and left coronary artery. Collectively, these all circulation is called coronary vascular system or coronary vascular circulation. The right coronary artery have important the posterior descending artery and marginal artery, right marginal artery. Left coronary artery have important two divisions. The one is left anterior descending artery LAD, and the second one is circumflex artery. So, in ischemic heart disease, we will discuss that what is ischemic heart disease, why it affect left side of heart as compared to right side, and little bit about what is ischemia and what is hypoxia. So, ischemic heart disease is this is the pathological syndrome of coronary circulation, due to which what happened, due to which imbalance occurs in oxygen supply and oxygen demand to myocardium of heart. In ischemic heart disease, we will pause on the coronary circulation mainly on left side. This is called syndrome because this is a condition in which mostly more than one disease is involved. So it is called the pathological syndrome of coronary circulation, due to which imbalance occur in oxygen supply and oxygen demand. Mainly in adults and normal males and females, there is balance in, for example, we have a scale here. We have a scale. In normal conditions, oxygen supply is balanced to oxygen demand. What is oxygen supply? Oxygen supply, for example, we are taking the ventricles of heart here. I have, this is left ventricle and this is right ventricle. And as in previous lecture, we have discussed that there is blood supply to these muscles. This is myocardium, and as you know from ECG lecture that myocardium have three layers mainly. This is called subepicardial myocardium. This is called middle myocardium. and this is called subendocardial myocardium. This is the circulation, or this is the general structure of the ventricle. So from here, these muscles taking oxygen and nutrients from coronary circulation, and the oxygen needed by these muscles, these myocardium, is called oxygen demand. Oxygen needed by myocardium for normal function is called oxygen demand. And the oxygen and nutrients, mainly oxygen supplying by coronary arteries to myocardium, is called oxygen supply. Mainly oxygen supply and oxygen demands are in balance, mean 50%, 50-50, 50% and 50%. If the myocardium needs 50% of oxygen, the coronary circulation supply 50% of oxygen. If this demand is increases, oxygen supply also increases in normal. For example, if a normal man is exercising, workout, due to that workout, his heart rate is increases, mean he goes to tachycardic state. The heart rate is increases as compared to normal heart rate is Mehran, normal heart rate is 60 to 100 beats per minute. During exercise, heart rate is increases, mean more than 100, and this condition is called tachycardia. So due to this tachycardia, the heart muscles needs now more oxygen as compared to resting state. Oxygen demand is increases, so oxygen supply is also increases. As you see that if we are exercising, when we are exercising, our breathing rate also increases. This breathing rate increases due to this demand. If the heart muscles requires more oxygen, the respiratory system supplying more oxygen to blood, and blood supply more oxygen to heart muscles. If due to some pathological condition, for example, I am taking this heart again here. For example, this is heart, and this is coronary circulation. If due to any pathological condition, for example, if there is some blocks made due to fats or something else, or embolus, now the blood supply to this coronary circulation is decreases, and heart muscles demand is increases, and this condition is called the imbalance between oxygen demand and oxygen supply. Now due to this block, for example, this is cholesterol block. Due to this, now oxygen supply to these heart muscle will be decreases, and oxygen demand increased. This is called the imbalance between oxygen demand and oxygen supply, and due to this, these muscles will not work properly. Then if there is demand, if oxygen demand is increases and oxygen supply is decreases, due to this, these muscle will not work properly, and the heart is now in ischemic state, and this is called ischemic heart disease. We will go in detail for ischemic heart disease. Now, for now, if there is oxygen, we will discuss the causes of ischemic heart disease. There are two factors. These factors, which those factors which decrease the oxygen supply, and those factors which increase the oxygen demand, are both the causes of ischemic heart disease. So this is generally the introduction of IHD, that pathological syndrome of coronary circulation due to which imbalance occur between the oxygen supply and oxygen demand of myocardium, and this condition is called ischemic heart disease. Now, after this, we will discuss two or three characters of ischemic heart disease. Mainly, we called it pathological syndrome because this, if any abnormality occur in these arteries, it will called CVD. It will called CVD. CVD mean coronary vascular disorder or disease. Coronary vascular disorder or coronary vascular disease. Ischemic heart disease is a type of CVD. Ischemic heart disease is a type of CVD. Other types we will also discuss because all are included in your course also, and for good doctors it is must to know about all the coronary diseases. For example, now we are discussing IHD, ischemic heart disease. We will also discuss angina. We will also discuss myocardial infarction. We will also discuss hypertrophy obstructive cardiomyopathy. For example, these are all the types of CVD. So, ischemic heart disease is the main type. If we go for epidemiology of ischemic heart disease, epidemiology, according to World Health Organization, according to World Health Organization, worldwide 3.8 million 3.8 million men and 3.4 million women are caused by CVD. Mean worldwide 3.8 million men and 3.4 million women are the population which is caused by coronary artery diseases, coronary vascular diseases. It's mean that 1 out of 3, according to your book updated Davidson Medicines, 1 out of 3 men and 1 out of 4 women are caused by CVD. Among every 3 men, 1 is caused by CVD, and among 4 women, 1 woman is caused by CVD. And these 2.8 million, this is coronary vascular disease. I already told that there are types of coronary vascular diseases. Among these, we are discussing IHD. So 2.8 million are living with ischemic heart disease or CVD, coronary vascular diseases. Among these types of CVD, IHD have its own place because worldwide IHD is the most common CVD. Ischemic heart disease and CVDs, IHD is most common worldwide. And this is the most common cause of death. Most common cause of death, and is the most common disease in people, which are caused by coronary vascular diseases. In some research, there is 1.8 million dies from IHD every year. In each year, 1.8 million population or people are die due to IHD. It's mean that in every second, in every minute, one person is dies from IHD. This is very major cause of death nowadays. This is presently. This is in every minute, not one. In every minute, there are a lot of people die due to IHD, ischemic heart diseases. So this is the epidemiological rate of ischemic heart disease. After this, there are some question arises in brain that what is mainly the difference between ischemia and hypoxia, isolated hypoxia. Some students or some doctors, as you imagine that they are thinking that hypoxia and ischemia are same words, but they are not. There is some difference between ischemia and isolated hypoxemia. For example, we have two wording. The one is ischemia. Ischemia, and the second one is isolated hypoxemia. Hypoxemia. 3 points always remember with yourself. Good doctors memorize that ischemia and hypoxemia is same thing, but excellent doctors know the difference, the actual difference between ischemia and hypoxemia. There are 3 points in ischemia. First, oxygen supply decreases to heart tissues or any other tissues of body. Oxygen supply. The second thing, other nutrients also decreases. Nutrient supply also decreases. Third thing, reduction in reduced washout of metabolic wastes from tissues. For example, we are discussing heart, so we will talk about heart, that if we have this heart, and these are heart muscles, in normal condition, the oxygen demand and oxygen supply is in equilibrium state. But during ischemia due to any cause, these are coronary circulations, oxygen supply is decreases to these muscles. Also nutrition's main nutrition is glucose. It also decreases. And waste products wash outing decreases, so waste product accumulation increases in these muscles. And if there are more waste products, it will affect the heart muscles also, it will weaken it. And what is isolated hypoxemia? These 3 points are about ischemia, and this condition is called ischemia. When there is reduction in oxygen supply, there is a reduction in nutrient supply, and there is reduction in washing out of metabolic waste. because heart muscles also metabolize some nutrients or food nutritions, and the waste product which are produced in this metabolism will accumulate and stay here, and it will affect the heart muscles. Now isolated hypoxemia is when only oxygen supply is reduced. Only oxygen supply is reduced due to some other cause. If there is only oxygen supply reduced, for example, severe anemia, severe anemia, in anemic state, there is decrease in blood, and due to that hemoglobin is reduced, and hemoglobin cannot then supply oxygen, so anemia is caused, and this is the cause of reduced oxygen supply, and this is called isolated hypoxemia. The second cause is severe pulmonary diseases. For example, if we took alveoli, this is for example alveoli. In normal conditions, oxygen comes here, diffuses to blood, diffuses to blood. But if someone is caused by TB, if someone is caused by TB, here due to TB, the mucus is thickened here. This is mucus, sputum. And due to this thick layer of mucus, oxygen cannot diffuse to blood. Oxygen cannot diffuse to blood. So oxygen is reduced in blood. And due to this blood is not able to fulfill the demand of heart. Now, for example, here is the heart. It requires oxygen, and this blood goes to heart in the form of coronary arteries. Now from here oxygen is not diffuses into blood, so the oxygen amount in blood is reduced. Here also oxygen is reduced, and it requires more oxygen, right? So oxygen supply is reduced to heart muscles, and this condition, this is called isolated hypoxemia. And if with oxygen the nutrients and metabolic waste they are increases and the nutrients decreases to these muscles, then it will called ischemia, and this disease is ischemic heart disease. Now after this, note, write it with yourself. This is very very important for your exams also, and for daily life, and for treating patients. That ischemic heart disease caused in left ventricle 90%, 99% more than right ventricle or right heart. Mean ischemic heart disease 99% it will affect left side, and right side it occurs very very rarely, and there are some reason behind this point. Now we will discuss these points. For example, now our topic is why IHD affects left ventricle more as compared to right ventricle. There are some reasons. The first, for example, we make a simple table here. On one side, we will show the right ventricle, and on this side, we will show left ventricle. The first point, the thickness of right and left. If the tissues are thick, it will need oxygen more than thin. And as we all are well aware that left ventricle is more thickened than right ventricle. First point is thickness. Thickness. Right ventricle thickness is from 0.3 to 0.5 centimeter. 0.3 to 0.5 centimeter, and the thickness of left ventricle is 1.5 centimeter. For example, we are taking ventricles here. For example, I have this is the thickness of myocardium. This is left side, this is left ventricle, and this is right ventricle. This thickness is 0.5 centimeter, and this thickness is 1.5 centimeter. So the left ventricle is more thickened than right ventricle, so it will demand more oxygen than right ventricle. So the second point is oxygen demand is low. Oxygen demand is low in right side, and oxygen demand is high in left ventricle. This is the second point. Due to this thickness, oxygen demand is low in right ventricle and oxygen demand is high in left ventricle. And as we discussed already, that this is the imbalance between oxygen demand and oxygen supply. So if left ventricle requires more oxygen, and there is some pathological condition due to which the heart is not able to supply that much oxygen to left ventricle, it will caused by ischemia, it will caused by ischemic heart disease. So this is the second point which cause left ventricle ischemic heart disease more than as compared to right side. The next point is the pressure. Blood pressure. In right side, the blood pressure is increased from 0 to 25 mm of Hg. 0 to 25, but the pressure in left side is from 0 to 125 mm of Hg or 130. It squeezes with more pressure and it squeezes with less pressure. So after this, it squeezes with more and pressure is low here, so it squeezes its microcirculation. What is microcirculation? Coronary circulation. So if it squeezes its microcirculation with low pressure, oxygen supply will be high here as compared to this pressure is high, so it squeezes its microcirculation with high pressure. So it will blocks its microcirculation, so oxygen supply will be reduced here. This is the next point which is responsible for causing ischemic heart disease in left side as compared to right side. For example, if we take an example here, for example, I have this left ventricle and right ventricle. Here the pressure is 125 mm of Hg, and here it is 0.25. For example, I already told that there are three layers. There are three layers of myocardium. Three layers of myocardium, and the circulation is present here. For example, these are the micro circulation and this is the micro circulation. We separate this myocardium from each other for understanding. For example, if I have, this is the endocardium, myocardium, this is the middle myocardium, and this is epicardial myocardium, is like on this side. For example, I have, this is epicardial myocardium, this is middle myocardium, and this is endocardial, this is epicardium, and the microcirculation is present here in myocardium, right? It squeezes due to pressure during contraction. It squeezes. For example, it squeezes its microcirculation with less tension. Now blood can passes from here and it will supply the myocardium, but because here is the pressure is 0 from 25 mm of Hg, here it will contract with more pressure, which is about 130 mm of Hg, 130 mm of Hg, and it squeezes its microcirculation very much that it blocks its blood supply. Now these muscles which contract the left ventricle are not feeding from coronary circulation. It's not feeding from coronary circulation, so oxygen supply is reduced. Here oxygen supply is present during systole. Systole means contraction. So oxygen is supplying, so there is very low chance of ischemic heart disease. But here there is no oxygen supply during systole, during contraction of left ventricle, mean it's now not feeding from coronary circulation, so there is high chance of ischemia in left side. This is the next point. Understand, right? This is the next point. Due to low pressure, it squeezes its microcirculation with low pressure, with low tension, and it squeezes its microblood. Even it blocks or it impede its circulation during systole with high tensions. So there is high risk of ischemic heart disease during in left side as compared to right side. Now if we go for work, I already told that heart muscles are working 24 hours, but there is difference in workout of right and left side. Its squeeze is more, its thickness is low, its pressure is low, so it work low work. little work. It's doing little work right side. As compared to right side, it's doing more work, because here is one other reason. From here, the blood is only going to lungs, for oxygenation, but from left ventricle the blood is going to whole body, so it will do more work as compared to right side. And due to this reason, this low and high work, there is low chances of ischemic heart disease and there are high chances of ischemic heart disease. These are the points due to which the left side is in high risk with ischemic heart disease as compared to right side. Now after this we will go for the causes of ischemic heart disease. Causes of ischemic heart disease. Remember, there are many causes of ischemic heart disease, but we will discuss only the important causes. For example, the first and the most important cause is atherosclerosis. Atherosclerosis is the formation of plaque or plaque formation in coronary circulation. For example, this is the coronary circulation and fats accommodates here and it form a plaque here. This is the obstructions for coronary circulation. This is called atherosclerosis. We will discuss it in detail. The second cause is vasculitis. Vasculitis means if there is some hypertrophies take place in coronary circulation. For example, if I have, this is coronary circulation and there are some hypertrophic state, that its size is increases. So when increases, the luminal blood flow in coronary circulation is now decreases, and due to this ischemic heart disease occurs. The third cause which is very important is smoking. Mainly tobacco smoke. In coming lectures, we will discuss this in detail, that what factors are responsible for reducing blood supply, oxygen supply, and what factors are increasing oxygen demand. But the other causes of ischemic heart disease is vasospasm, and the next is aortic stenosis. So these are the main causes of ischemic heart disease. But among these all, we have the one and the only important cause is atherosclerosis, which is mainly 90% IHD is caused due to atherosclerosis or a trauma formation in coronary circulation. So in next we will discuss the causes and pathophysiology of ischemic heart disease, and also we will discuss the categories of ischemic heart disease, like angina, like unstable angina, like STEMI, infarctions, and one is vasospasmodic, which is also called as Prinzmetal's angina. So we will discuss the causes and categories of ischemic heart disease in detail in next lecture. Thank you.